Sciences Centre. I want to begin today by acknowledging that HSC Shared Health provides services in facilities located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the national homeland of the Red River Métis Nation. We respect that First Nations treaties were made on these territories and acknowledge the harms and mistakes of the past. We dedicate ourselves to collaborate in partnership with First Nations, Métis, and the Inuit people in the spirit of reconciliation. It's great to see so many familiar faces here today for an announcement that's been years in the making. Thank you all for being here. Today is a big day for all of us at the Health Sciences Centre. At this time, I would like to invite Premier Heather Stefanson to the podium to make an important announcement about the future of HSC and the Bannatyne campus.
Thank you, Sean. Thank you very much, Dr. Young, and it's great to be here with everyone today. Dr. Gray, great to have you here with us, and Jonathan Lyon from the Health Sciences Centre Foundation, of course, Minister Gordon as well, Minister of Health, who's here with us. We also have the Chair of Health Sciences Centre Foundation, Tina Jones, who's here, and many of our clinical leads and others who are here for this really exciting announcement. So just so honored to be here with all of you today. We have a vision and a plan to revitalize our healthcare system, and today we are announcing one exciting part of that vision. In our government's last throne speech, we committed to redeveloping aging healthcare infrastructure with significant new investments. This year, we passed Budget 2023, which is providing historic help to Manitobans with real results and helping heal our healthcare system. In this budget, our government committed to revitalizing and enhancing the Health Sciences Centre campus in the coming years. We know just how important HSC is to our healthcare system. As Manitoba's main tertiary care centre, HSC's dedicated physicians and staff are responsible for treating patients most in need in specialized care. We also know how integral our healthcare workers are to our system. The Rady Faculty of Health Sciences is training the doctors, nurses, and healthcare workers of the future right here at the Bannatyne campus. That's why today we are announcing an historic investment of over $1.5 billion here at HSC to build new bed towers to increase capacity and improve patient outcomes, and an expansion of the Bannatyne campus. This is yet another historic investment into healthcare with the largest health capital investment in Manitoba's history. It will create at least 240 new state-of-the-art patient rooms. It will create space for new, complex procedural and diagnostic services, and it will allow for the expansion of the adult emergency department and add more clinic spaces. It will replace this nearly 70-year-old building that we're in today, which, as you can see, has reached its end-of-life span. And it will provide $72 million to expand the Rady Faculty of Health Sciences Bannatyne campus. So we, of course, know that that means more nurses, doctors, and healthcare workers will be trained right here in Manitoba. This builds on our $400 million plan to retain, train, and recruit more healthcare workers to our province. Over the next year, HSC will transition outpatient services to the Manitoba Clinic, which I know the HSC Foundation will touch on in just a bit. This project would not be possible without the incredibly hard work and collaboration of the Health Sciences Centre Foundation, and we thank them for everything that they do for the HSC. We are able to start this project now, thanks to the HSC Foundation. This will expedite the redevelopment of the HSC facility. Health foundations like the HSC Foundation are pivotal to advancing healthcare infrastructure across the country. We thank them and their board chair, Tina Jones, and their generous donors for their passion and commitment to this project and to patients. And that's what this investment is all about, better care for patients in Manitoba. Healing healthcare means putting patients first and ensuring the quality healthcare and services are there when Manitobans need it most. This is our plan and our vision to bolster Manitoba's healthcare system now and into the future. And I want to thank all of our partners who worked so hard to bring this plan to fruition, including the leadership here at HSC, Shared Health, the University of Manitoba, and the HSC Foundation. A stronger HSC will create a stronger healthcare system for all Manitobans, and this project is the first step in our commitment to improving this very important hospital. Thank you all for being here today.
Okay, thank you, Premier. Our next speaker has been instrumental over the past 2 years in championing our vision for the future of HSC. Please welcome the Minister of Health, Audrey Gordon.
Thank you, Dr. Young, for the introduction, and good morning to everyone. I want to start by thanking Premier Stefanson for today's exciting announcement. And thank you to the health system partners and leaders, to frontline workers, I refer to them as our healthcare heroes, our union stakeholders, employers, regulators, and post-secondary institutions. And I see many leaders from across the HSC campus here today. Thank you for taking time out of your very busy schedules to join us for today's announcement. HSC is Manitoba's provincial tertiary centre for trauma, transplants, burns, neurosciences, complex cancer care, and pediatric care. Every clinical hospital-based service available in the province is offered here at HSC, with the exception of cardiac surgery and eye surgery. This means for the majority of Manitobans, tertiary care is provided here, regardless of which community you may live in. HSC is also a teaching hospital affiliated with the University of Manitoba and other post-secondary institutions. Students learn here right at the bedside. They're in labs, they're in classrooms as well, and many of the staff teach and conduct research at these institutions. Today's historic investment to heal our healthcare system lays the groundwork for the enhancement and expansion of patient care services at Manitoba's largest hospital, currently covering more than 39 acres of land and employing more than 8,000 employees. This investment is integral to maximizing the potential of HSC and the Bannatyne campus, improving patient outcomes, as the Premier said, and ensuring highly specialized provincial services have the necessary room to grow for decades to come. The investment in the new building, which is anticipated to be at least 10 stories high, will create approximately 240 new personal patient rooms, each built to meet current infection prevention and control guidelines. It will also enable the use of general hospital acute rooms as personal rooms, establish campus space for new, complex procedural and diagnostic imaging services. And it will allow for the expansion of the adult ED, as the Premier mentioned, and associated clinic spaces to support patient care and provide for better patient flow. And it will address clinical capacity needs, including space to expand critical care units in the future if that is needed. Now, the plan also outlines the inherent strategic strengths of integrating clinical, educational, and research facilities at one location. A long-term goal of the capital plan is to have all University of Manitoba health sciences faculties consolidated onto the Bannatyne campus to increase the education, learning, and research capacity of students and staff. So in preparation for these moves and to accommodate the university's planned expansion of medical training seats, which was approved by our government, this investment includes $72 million in the first stage to expand the Rady Faculty of Health Sciences infrastructure to support growing campus needs. Our government has invested billions of dollars in capital upgrades throughout the province, including new hospitals in Portage la Prairie and Neepawa, and significant renovations to sites in Brandon, Selkirk, Winkler, Morden, Steinbach, Aschern, and Dauphin. And a new emergency department is also being constructed at the St. Boniface Hospital, and our government has committed to the development of a $300 million plus urban center for health excellence in downtown Winnipeg, with the Pan Am Clinic being the anchor tenant. These capital investments also align with ongoing efforts to retain, train, and recruit healthcare staff as part of our $400 million Health Human Resource Action Plan. Our government is healing healthcare, investing in healthcare and healthcare professionals, and building our health capacity right here in the province. Thank you. Merci, miigwech.
Thank you, Minister. The HSC Foundation is an integral partner developing a long-term plan for our campus and providing us with the necessary support to help bring this project together. I would like to welcome John Lyon, the Foundation's President and CEO, to the podium to say a few words.
Thank you, Dr. Young. Good morning, everyone. Welcome, Premier, Minister Gordon, Dr. Gray, Board Chair Tina Jones. There's many great friends, supporters of the Foundation, clinical leadership here. Pleased to see Dr. Nickerson, the Dean of Medicine, and Stefano Grande, the CEO of the Children's Hospital Foundation, both of which are doing fantastic things on this campus as well. I'm John Lyon. I'm the CEO of the Foundation, the HSC Foundation, and I'm extremely excited to be part of this historic announcement for the people of Manitoba. Like so many Manitoba families, HSC has touched my life.
Attention, please. Any area or unit having taxi chairs or wheelchairs, please bring to the 700 William Avenue entrance as soon as possible. Once again, any area or unit having taxi chairs or wheelchairs.
I think Dr. Buchel's doing this just to mock me. I've seen firsthand how the doctors, nurses, and allied healthcare professionals who provide specialized care at Manitoba's hospitals save lives. HSC is the hospital that provides advanced care in our province when families need it most. My family is one of these families. I've been a patient here. My family members have been patients here. I've seen lives transformed. I know many of you have had experiences here as well, and we're grateful to the healthcare provided at HSC by the incredible staff. Working at the Foundation, we're fortunate to see these stories every day. But I also understand the challenges that come from providing care in legacy facilities such as this. The patient experience, it has to matter. When you are here, you are in the hospital, it can be a most difficult time for you, for the people you care about. And going through that experience, frankly, in dated buildings, designed for many years ago, is not ideal. It's hard to find privacy. It's hard to find personal space. It's a challenge for the dedicated doctors, nurses, allied health professionals to create the best possible patient experience. And at the Foundation, we see those challenges. All of us at HSC and the Foundation have been working for years to share this story, to identify this issue, and to drive for a solution, to help bring a day like this closer. And here we are. What a great day. The $1.5 billion adult bed tower project that our Premier announced today, along with the advancements to the U of M, is historic. I'm grateful for the Premier's vision and collaborative approach that she brings and that of her government to undertake this project, and more importantly, having a plan that allows for this to happen, and it will happen now. Starting to rebuild the adult bed towers is a major undertaking, the largest, again, investment in the history of our province, but there is going to be more going on than numbers. Look around here, right where we are right today. Yes, the healthcare services and skills are as modern as you find, but the building needs work and it has to be done. It's a duty for Manitobans and it's time to move forward. What is today? That is what today is about. We're looking to the future. This is a generational project for HSC. You will hear today about new beds, about new capacity, new private beds, the new clinical capacity. And believe me, this is all so very important. But for me, for us, the best part is what will mean for the patient experience. As I said, being hospitalized is a stressful experience for patients and their loved ones. That's why we want to provide better experiences for patients and the loved ones who support them. That is at the heart of this plan. Why today means so much to us as a foundation, to everyone who has been and will be touched by Manitoba's hospital, HSC. So the investment of $1.5 billion announced by our Premier will drive this forward. And again, we're very grateful for that. But I am proud to tell you that our foundation has helped to ensure it can start now. So let me explain. You cannot close HSC while the demolition gets underway. Some HSC programs will need to relocate while the rebuild goes forward. Finding a temporary location for these programs might have taken 5 years, likely longer. That would have meant 5 more years waiting to get started on the future, waiting to improve the patient experience and provide modern facilities for our healthcare providers to work in. Instead, the project starts now. Today, I'm pleased to announce the HSC Foundation has agreed to acquire the Manitoba Clinic building. As a result, HSC Foundation is now able to provide an ideal temporary home for HSC programs that need to move during the rebuild. This innovative agreement will allow us to acquire the Manitoba Clinic without spending any donor dollars, and no donor dollars will be used to support the operation of the building going forward. This is a great example of what HSC Foundation does best: specific, timely, and essential investments, helping to deliver tomorrow's healthcare today in collaboration with all the partners involved in delivering healthcare at HSC, Shared Health, the provincial government, and the leadership of the province. We're extremely proud to serve as a catalyst for this project, and I want to thank our board chair, Tina Jones, and the members of our board of directors for their input, guidance, advice, and unanimous support to move forward, and which has helped create this big day. I also want to thank our CFO, Paul Cadieux, for his leadership, tenacity, and vision. Paul has worked long hours for an extended period of time, which has allowed us to announce this agreement to acquire the Manitoba Clinic and expedite the bed tower redevelopment. Again, this has been years in the making. Some forces have aligned to allow this to come together at this time, and it's just the right thing to do for the people of Manitoba. It's the right thing for healthcare. It's the right thing for HSC, and we will all benefit. And I want to recognize the collaboration for members of the team at HSC, Dr. Young, Dr. Gray, Shared Health, the provincial government, so we're able to act on the opportunity to kickstart this project. So, in conclusion, what you're hearing about today is the result of a true team effort, one that will help transform HSC for the future, providing better experiences for patients, the loved ones who support them, and those who care for them. And in doing so, providing a major improvement to the hospital that is the cornerstone of Manitoba's healthcare system. Thank you all very much.
Thanks, John. As Chief Operating Officer of Health Sciences Centre, I can say with first-hand knowledge that a proposal to construct a new inpatient building did not magically appear overnight. Rather, it is a culmination of years of study and work from so many people to bring us to this point. One of the people leading that work was my friend and colleague, Dr. Perry Gray, Shared Health's Chief Medical Officer and Provincial Lead of Medical Specialist Services. There is nobody I know that has put more of his time, effort, and energy into support of Manitobans, Health Science Centre, our staff, and our patients than Dr. Gray through his career. I'd like to invite Perry up to talk.
Thank you, Sean, and good morning to everyone. Approximately 40 years ago, I was a medical student on a surgical ward in the general center of the Health Sciences Center, one floor down and that way. And just over 30 years ago, I began practicing here at Health Sciences Center in general surgery and critical care. For me, HSC has always been a place where wonderfully talented people do great things for patients, often in aged or undesirable patient spaces. Over the past 30 years, I've seen many changes, including improvements to many of our spaces for patients accomplished by renovations or new buildings. But the largest proportion of our beds here at HSC, those within adult medicine and surgery wards, have been largely untouched, with the exception of some minor improvements in select areas. Today, I'm very pleased to be present for an announcement that will address those needs and that allows HSC's vision of patients first to take another step forward. Today, we take our first step towards private patient rooms in these areas with dedicated accessible washrooms and sufficient space for their family to visit. We take a step towards patients being able to discuss their medical condition with their family in the privacy of their own room, free from disturbance. This announcement also marks a significant step towards efforts to reduce hospital-acquired infections that can be a reality in shared spaces, including patient rooms and shared washrooms. And we offer our patients improved ability to rest in a quiet, private space. All of this is important to patients and their families, but it is also important to our employees and our medical staff. As healthcare providers, we care very much about patients, and we want to provide the best care we possibly can. There's no worse feeling for dedicated staff than leaving work at the end of your shift, believing you have not done well by the patient. Appropriately sized private rooms enable staff to have easier access to the bedside, easier ability to get multiple providers in a room to assist the patient, easier to transfer to a stretcher or a wheelchair when required, easier to move equipment into and out of the room. Appropriate space helps us provide improved patient care, something that is very important to the dedicated staff at HSC. However, from my perspective, there's much more to this project than all the benefits of private, appropriately sized patient rooms. Since I first stepped through these campus doors as a student and over my 30 years of medical practice in Manitoba's largest hospital, I've witnessed remarkable benefits to patients that come from innovation. What was almost bordering on science fiction when I started medical practice is now standard of care, or what I would call science fact. We can treat more effectively now than we could in the past, but it will be even better in the future through innovation.
Attention please, will the parent of Makar Perry return to children's EEG? Once again, the parent of Makar Perry, please return to children's EEG.
Innovation has taken many forms, from new medical therapies to minimally invasive surgery to advances in interventional radiology, and of course, better trained and functioning interprofessional teams. Better healthcare is in the future. Better healthcare is consistent with HSC's vision of patients first, and it is also consistent with the HSC Foundation vision of tomorrow's healthcare today. And with this announcement, the opportunity will be created to bring tomorrow's healthcare to the province sooner. The increased space will allow for growth in programs needed to support the healthcare needs of Manitoba's growing and aging population, with the surgical, diagnostic, and outpatient services identified within the Provincial Clinical and Preventative Services Plan. My profound thanks to you, Premier Stefanson, Minister Gordon, and to you, John, and the entire HSC Foundation for your commitment to patients, your commitment to our staff, as we strive towards improved care for all. What is being announced today is something I've hoped throughout my time at HSC. I also want to thank the many, many people who have worked tirelessly over the last few years to develop this project and get us to this day. This is a great day. Thank you very much. Good day.
Thank you, Perry, and thank you all for joining us today. I mean, just going back, it is interesting what we've been through at HSC over the last several years. Many parts of this building that are still used clinically today were built when horse and carriage brought people to the hospital, and our ambulance was actually a horse and carriage. So this is indeed pretty thrilling. We'll now open the floor for questions.
In terms of this private, I guess the private bedrooms here, are we saying that does not currently exist in the Bannatyne Avenue, or whoever can answer that?
We have very, very few single bedrooms at HSC. Did you want to comment, Perry?
Well,
Yeah.
we'll both comment. Okay. I think the largest consolidation of private rooms outside of the intensive care unit that's located on the 7th floor is our GD6 bone marrow transplant unit. That has private rooms, specially tailored, and it reduces the capacity of that particular unit by more than 50% or approximately 50% to achieve that private room. Most of the other floors, the medicine and surgery wards, there are sporadic private rooms throughout, but most of them are multi-bedded rooms. The vast majority are multi-bedded rooms. And when a patient requires isolation, you sometimes have to close the bed beside, further reducing your capacity within a very, obviously important bed base.
Will there be a net increase in beds as a result of this? Do you know how many?
There'll be a net increase in physically available beds for sure, but the most important thing is the net increase in rooms. I mean, even if one kept the bed map identical, Dr. Bushell would tell me many times over, and has, that the number of rooms he has to close every day because a patient needs isolation or a patient needs the 2 beds becomes 1 beds forced upon him because of either an infectious risk or a potential violent patient risk or a whole bunch of other reasons. Even if one kept the number of beds the same, the capacity would increase markedly by having a much higher percentage of private rooms available for all. Of course, this will also give physical space necessary for bed expansions as required. And even the patients left behind in this aged structure will have the opportunity to have private rooms. They won't be as large as the rooms in the new building, but at least they will be private, and a lot of them will have their own washroom, but still not even all of them.
A question for the Premier. The bigger the dollar amount, the more important this question becomes. I realize it's over 6 years, but what's the government's plan to pay for this?
Yeah, so this has all been budgeted for. This is part of our budget for this year. But over the course of the next 5-6 years and however long it takes to get it done. We need to start somewhere, and you'll know as well, Steve, that we announced this in our throne speech last November, and it was part of our budget this spring. So this is something we've been planning for a little bit now, but maybe not as long as Perry and others have been planning for it, but we're just happy to be a small part of making sure we get it done.
Well, I mean, the 1.5 billion hasn't been set out in the budget. As far as I understand, it's annual budget, and we're talking about a multi-year plan.
Yes, it's a multi-year, yeah.
So how does the government intend to pay for this, given the fact that we haven't really balanced the budget in 13, 14 years?
This will be part of, every year there's a capital budget for health, and so this will be a part of that.
And how much time you said 6 years for the building of the tower?
Yes.
And when do you expect demolition to start? What's the fund date or?
So I'm out of my bandwidth here. The head of capital planning, who Dr. Gray and I and Dr. Young and I talk to frequently. So there's a cadence to this. So today is the announcement. Then there's going to have to be the discussions internally with the various clinics to say, okay, who's coming over to the Manitoba Clinic property, and that will empty out space, and then they'll have to do their proper processes for tendering and such, and start clearing out space so that you can build a new tower. So that is sort of roughly the cadence of this. Today's the kickoff with the announcement, and then a host of activities will take place to ensure this project comes in on time, on budget. But again, we're able to fast track it 5 years by having acquired the Manitoba Clinic.
And you spoke about demolition. Which buildings exactly will be demolished?
So again, out of my bandwidth, but there is a campus plan that Shared Health, and they will be better suited to speak to it. I'm not sure, Dr. Gray, if you're better suited to speak to it than I, but there is a cadence to this and a plan behind this announcement to move things forward.
And you mentioned something about donor dollars. You said they wouldn't be used for what exactly?
So we did not. So we have been able to acquire the Manitoba Clinic using credit facilities. We have not, because we're a foundation, we receive money from donations. We have not applied to this process any dollars to acquire the building, and none will be required to operate the building. So, because we've taken an innovative approach to undertake this project. So again, credit to our board and our CFO for working through this, but it's an assurance that we have that donor dollars are not going to buy that building. That is a commercial project that we've undertaken as a foundation that we have the capacity and mandate to do, and we knew it was necessary to expedite this redevelopment, as the Premier alluded to, and we're thrilled to do so.
It's no donor dollars, but no dollars, period?
No donor dollars are into this project.
Are dollars being spent on buying this? I'm no expert on creditor protection, so.
Right. So we've got credit lending facilities, so there's tenants of the building. Tenants pay monthly rent, and that will support the operations of the building.
And will any service, well, I mean, what happens to the services that already exist at Manitoba Clinic? I know there's been some struggles in offering the full.
Right.
gamut of-
So as noted, there's existing tenants, and that is all this is all part and parcel of being finalized and worked through, but they're in place. And then we have an agreement with Shared Health to take a significant footprint of that space to allow for the decanting of HSC programs to go into the Manitoba Clinic. So Shared Health will be a tenant of the building that we own.
Existing services won't be relocated?
No, there's going to be services.
At the Manitoba Clinic, the existing Manitoba Clinic services?
Yeah, so there are services that are there, but there's available space. Roughly half the space is available right now. There are no tenants in half the space. So we've got an agreement with Shared Health to take that space on a long-term lease so that we can decant these programs at HSC into that space, and that's where you get the 5 years. Otherwise, the first leg of the stool would be the government would have to build a building to allow the programs to decant, because HSC is such a massive, full campus. We can't just stop programs and stop providing care. We have to have, and that's again how we can expedite it. So by making the Manitoba Clinic available, by the foundation taking the ownership of that, that's how this is fast forwarded by 5 years.
Are the tenants of the Manitoba Clinic now agreeing to stay? Do you have long-term agreements with them? What happens if they leave? Where
So we have arrangements in place that sort of factor in all of those potential outcomes. And again, we've got an agreement in principle, because it's a court ordered process. That will have to be confirmed at the court, but we have an agreement in principle with lending facilities and through Alvarez, who's the creditor or the monitor for the project, that will allow this project to go forward.
And Dr. Gray, how will the patient care of those who are moving over to the Just wait for that. So that's part of what John alluded to as to the discussion that we need to have starting immediately, is what patients can go over there, because the Manitoba Clinic will not be a tunnel-connected space like many other aspects of the campus. Now, it will also not be the first building HSC has that is not tunnel-connected and having a direct link with the hospital. Dr. Renner is here, and there's a medicine ambulatory care outpatient facility that HSC runs that is also not tunnel connected to the rest of the facility. There's dialysis capacity that is not tunnel connected to the rest of the facility. So patient care does occur already in HSC that isn't connected by tunnels, but you have to choose your patient and your population and your activity correctly. So mostly we would be looking at ambulatory care, people who are driving here anyway, and who are not undergoing intense procedures that would risk a code blue, where Dr. Ponovic would be a little annoyed if I did that. Patients will be selected and the clinical activities will be selected, more importantly, that will make it safe to be in a non-tunnel connected space. Because a lot of patients who come to HSC come from home, have their intervention or their appointment, and then leave.
Do we have the staffing, Dr. Gray, to make this work?
Well, staffing, of course, you know, everybody knows staffing is a challenge. I think this project actually enhances our ability to recruit staff, number one. Yes, moving and relocating a clinical activity from one building to another normally doesn't increase your staffing requirement. You know, practicing in larger spaces 5 to 10 years from now may lose some efficiency of staffing. We've seen that in previous projects, and may require some incremental staffing in the future, for sure, but not right away. And the kind of activities that we're talking about decanting as part of this first phase should be just as well served in our current part of the hospital at the Manitoba Clinic, and shouldn't come with a, oh, well, now we needed more staff because we're over here. And, you know, I would expect that to be minimal, or in some cases, zero.
Long term, once the tower is built, what happens to the Manitoba Clinic building there? What's the plan for it?
So I think it's fair to say that, you know, what is being announced today is the adult bed towers, which is one component of a campus master plan. And so like anyone, you know, you can forecast out to the future so far. We know that there's significant demand for space as we work to develop projects on campus. And dare I speculate, but I imagine, you know, the U of M is undertaking growth in their departments and will need space. Like we are landlocked and we are tight on new space. This is a 6-year-old building that is affording a great opportunity to advance a project now. And behind this project, future governments will have to consider other insignificant investments to ensure the care that Manitobans need. This campus is not going anywhere. This is a major investment, and it will require more investments down the road by future governments to consider. And we're confident that by having the space available, that'll be the opportunity to, again, provide space to decant as more activities take place, because there's lots of very old buildings on this campus that need to be demolished and replaced. And we are always going to require decanting space, not just for HSC, but I suspect for others involved in healthcare on the campus.
I'd like to, you just spoke about future governments, and the elephant in the room is that there's an election coming up in 2 months and 1 day. How does that affect the actual fact that the project will be happening, whether or not the...
So I'll just say, you know, I don't forecast elections. When I say future governments, it could be the future, you know, government like 20 years of Premier Stefanson. I'm saying in that context. Because we have secured a long-term arrangement with Shared Health, that is a signed deal. So that's happening. So the decanting, this isn't like, oh, we're gonna see what happens. This is happening. So now the process begins today to drive forward, to have those internal consultations that Dr. Gray alluded to with stakeholders to determine the right patient population to start moving into the building. Again, we have an agreement, we have to finalize it through the courts, but that runs a short period of time. But the process and the planning begins today, period. It's beginning today.
Well, and I can tell you that as long as I'm Premier of Manitoba, this will happen.
If I may, Premier, a cynical viewer might say, you know, you could have made this announcement months back or years back. You know, you're 2 days away from a blackout ultimately. Why did this take as long as it did?
This, actually, we announced that we would be moving in this direction back in our throne speech in November of 2022. So this has been a long time coming. This is not something that was that came up overnight. We also announced this as part of our budget last spring and this spring, and so we've been taking the action, the necessary action, ever since I became Premier. It was under 2 years ago that I became Premier of Manitoba, and we've been taking significant action, I think, in that direction. This is not something that happened overnight.
I just want to provide a follow-up answer to the person who asked about how many private rooms we had. And this location was chosen for a reason. It's normally one of our, what we call medicine clinical teaching units. One of the 3 medicine units that contains the sickest patients in the medicine program that doesn't require intensive care. And it's closed temporarily for some renovations, Dr. Young informs me. But if you want to count the number of 2-bed rooms after this event is done, count the number of 2-bed rooms and count the number of private rooms, and this is pretty typical of the number of 2-bed rooms and private rooms that medicine patients have available in the current state.
If I can, Dr. Gray, we've heard from your colleague that you've spent years on this project. You've been invested in this project. Why has this mattered to you so much?
Well, because I really do believe that patients deserve private rooms for care. I believe the semi-private room and the 4-bed room, while it might have a place in very select circumstances, and we do have very select circumstances where the 4-bed room or even the 8-bed room for a very short period of time might be advantageous for the patient and an actual good thing. But for the vast majority of patients in medicine and surgery, the private room is the standard. And it's not just a standard for patient comfort and family comfort. Those things are very important. Infection prevention and control make it a modern day standard. And this has been a modern day standard for a very long time. You know, for me, this has been a priority project for at least 20 years to get the General Center done. When I was a junior physician working on the Ann Thomas building, senior physicians were reminding me that they tried to get the General Center done since the 70s. So this has been a long time coming. And now other great things happened. There's a whole bunch of buildings all around us that are newer than the General Center. And I'm very grateful for that. But this is the one we never seemed to be able to get to. So I'm thrilled that we've pushed this one over the hill.
Last question. Just Premier, on a different subject, we are 2 days away from the blackout starting. You are able to now, with a legislative change, you are able to keep some ads running that are ongoing and existing. There are existing ads about tax relief and ankle bracelets and Crown prosecutors, etc. Will you keep some of those ads running into the blackout?
No, we won't. We will only be doing things that are informational to Manitobans, and that's how we'll move forward. Thanks, guys.
Thank you. Can we get a photo? Sure. Heather, can we get a photo?